Hi everyone, it looks like we're live. For those of you who are new, welcome to Talking Live with Macy. This is a time where we usually wait for 15 people to join us on the stream before we begin. I see the counter running already. So I'm just going to wait for 15 people to join us to actually start viewing and also be a part of today's stream before I officially begin everything. So if you're already watching in, you're already tuning into this, it's time for you to share this with your friends, with your family, because we need to let people know about ankylosing spondylitis, or short for AS, which is a type of arthritis. So once again, we want people to be diagnosed early with AS. So please share this right now. Get more people to join the stream. How it works is you can just press share at the comment section at the bottom of the stream. Share it with anyone. You can share it outside of here or actually on Facebook itself. So please do so as soon as possible. It looks like we have 15 people already on the stream, and I think there's more and more coming. So I'm very, very happy to see that. Welcome to Talking Live with Macy. I haven't seen all of you in 2 weeks. And I've missed all of you. I've missed having this session the past 2 Sundays. So for those of you who are new, what Talking Live with Macy is a talk show happening every Sunday or bi-weekly, especially on Sundays at 3:30 p.m. We talk about a lot of health issues, about wellness issues, and about issues that are important right now. It started during the first MCO and has continued up till now. I see all of you saying hi. So hi, all of you. Please stay on today's stream. It's very, very important. Please share it right now. So for those of you who are home watching this, that means you're home and safe. It looks like the COVID-19 cases in Malaysia is rising rapidly. It's very worrying, even for me. And I know some of you may already know there is a chance that there might be an MCO next week. So the most important thing to do for each and every one of us is to practice the SOPs. Be safe, practice social distancing. I don't have to remind you guys to do that. So that is my PSA to all of you before we begin. Today we have an exciting topic. We have 2 very important people joining the stream as well. So what we're going to talk about is ankylosing spondylitis. So many people think that senior citizens are the only people that get arthritis. But there is a type of arthritis that affects younger people between the age of 15 to 45. It is called ankylosing spondylitis. It is short for AS, where there is a long-term inflammation of the joints in the spine. Typically, any joints adjoining to our spine may then be affected, such as the pelvis area. The most important part about this is to be diagnosed early so we can manage it if you have AS. And today, we have a consultant rheumatologist and also the president of the Pertubuhan Arthritis Negeri Sembilan here with us. She is Dato Dr.Gun and her patient, Mr. Yong, who is going through AS. And they're here to share especially for Mr. Yong, to share his journey with us. And of course, Dato Dr.Gun is the expert. So I'm sure a lot of you know Dato here. And I'm sure you have many questions. So before we jump into the session with Dato and Mr. Yong, please start putting in your questions now. That means you can type in your questions so that I can pick it up for them at the end of today's session. So we don't have a backlog and your questions are not answered. So please start putting it in now. And this session is in conjunction with World AS Day 2021, happening on the 8th of May 2021. So please take note of that. Share this session out as much as possible. So hi, Dato Dr.Gun, and hi, Mr. Yong.
Hi, Macy. Hi, everyone.
So thank you so much for joining us today. And I'm going to jump straight into the question. It looks like there are a lot of people joining, and I think there's going to be a lot of questions for you, Dato. So I'm just going to start asking the questions, right? So the simplest questions, Dato, is what is ankylosing spondylitis and what's the prevalence of AS here in Malaysia?
Okay, Macy. Before I answer your questions, I just want to tell everybody about simple things about the joint in our body. So basically, we divide our joint into axial spine joint and peripheral joint. Axial spine joint meaning the joint over our back, from the neck go down to the pelvic, and the one we sit on it, we call that sacroiliac joint. That consists of axial spine joint. And the peripheral joint are the joints over the shoulders, the elbow, the wrist, the hands, and lower limb. We have the hip joint, the knee joint, the ankle joint, and the joints over our feet. So basically, this group, like Macy has clearly pointed out just now, ankylosing spondylitis. People has asked me before this is what is that? It's so difficult to pronounce, like a big dragon, right? So in order not to confuse all and make you all to pronounce this, we have a short form for this condition, and we call it AS. So everybody can pronounce AS. It's actually meant for ankylosing spondylitis. So ankylosing spondylitis is a form of chronic inflammatory arthritis, mainly involve the axial spine joint. So it can also involve the peripheral joint, but the main involvement are the axial spine joint. So therefore, patients usually will present with low back pain because the joint involvements are the back and also the pelvic, or present with buttock pain. At times they can also involve other peripheral joint, especially the large joint, which means the shoulder joint, the elbow joint, the hip joint, the knee joint, and the ankle joint that consider the large joint. It also can involve the joint where the tendon and the ligament attached to the bone, we call that enthesis, and the inflammation of the enthesis called enthesitis. So the commonest enthesitis that can involve in AS is over the Achilles tendon, and call that Achilles tendonitis. Okay, so other than joint, AS also can involve other organ. AS is a systemic disease where it also can involve the eye. Some patient can present with painful red eye, and we call that uveitis. And it also can involve the heart, the lung, and the bowel, associated with a bowel condition called inflammatory bowel disease, and also can associated with psoriasis. So in fact, Macy asked what is the prevalence of AS in Malaysia. We don't have the data. Okay, the AS prevalence differ from races and places, and I believe is about less than 0.5% of the population has this AS. But if you calculate if it is 0.5% of the populations have AS, we have 33 million people in Malaysia, and 0.5% will account for 165,000 people. That is quite a lot, isn't it? That is quite a lot. So many people think this is so rare, but it's actually not that rare. It can be affect you without you knowing it. So that's the reason we have this awareness. And there's present of this World AS Day. So it's a condition which is not that rare.
So thanks a lot, Dato, for answering that question, which about this not so rare after all arthritis. I think the next question would be a follow-up to what are the symptoms for ankylosing spondylitis and how do you usually diagnose it?
Okay, so as I mentioned just now, AS is a chronic inflammatory form of arthritis, mainly involve the back. So many patients will present with low back pain. Again, low back pain is a very common condition. So how do you know your low back pain is due to AS and not due to mechanical back pain? Okay, so here I would like to tell you 5 important things that you must remember. In AS, it presents with inflammatory back pain. So I want to teach you on what is inflammatory back pain. Inflammatory back pain usually occur at age less than 45 years old. So it can start from teens, in your secondary school up to 45. You may be 50 now, but your onset of pain is before that. it could be still in the inflammatory back pain. That's criteria number one. Number two, the pain is a chronic back pain, right? So it's insidious in onset and must be more than 3 months in duration. So it's not something that you carry a bucket of water and suddenly you feel back pain. That's acute back pain. Okay, so this is slow, insidious onset and a chronic back pain more than 3 months. And this pain, it actually, if you go to rest, you feel worse. If you do activity, then you feel better. So a back pain where relief by activity but worsening by rest. And you also get night pain, after a long night sleep. And at the second half of the night, many patients will just get up because of unbearable back pain, and they have to get up and to walk about, and by walking, they relieve the pain. So if you have 4 out of 5 of these criteria, you fulfill inflammatory back pain. Maybe you should come to see us, right? See a rheumatologist for that.
Okay, that I think all of us need to monitor. As long as the back pain doesn't cure by resting, rather than instead we need to do activities.
Yes.
We need to look for a consultant rheumatologist. Actually, then this leads to a question for Mr. Yong, who is a patient who has been living with AS. How long have you had AS, and how did you find out about your condition? Mr. Yong?
Hi, everyone. I think I have to say that this actually runs in my family. So it all started, as far as I can recall, with my late grandfather. So he had this very stiff neck. His neck couldn't turn, and he also had very bad hunch. And then he can't actually do a lot of movement. So then happened that my uncles and also my auntie also have some sort of ache at the back and also the leg. So when I was in secondary school, I started having stiffness as well. So I was a little bit hunched. And also I have actually learned how to actually live with all this pain and so on by doing, by keeping myself active. So I've been doing quite a fair bit of sports, like running. I play squash, badminton, and so on. But it was until 5 years ago that I had this acute pain in my ankle, in one of my ankle. And with that, initially I thought it should go away, because I always have this sort of pain here and there. But after some time, it just go away. But that dragged on for a year. I couldn't walk properly, not to mention exercising for 1 year. So there was a time that I actually went to see Dr. Gun, and after running through a series of tests and so on, I think I was diagnosed with this AS. So I think for me, I'm quite lucky to have been able to find out the cause, whereby for my late grandfather and also my uncles and auntie, I think they did not have this sort of opportunity to actually get themselves properly diagnosed. So I think that is the difference. So for me, I think it has been quite bad, because not only my back, my ankle, my legs, and also I have this arthritis, which means my eyes will get this inflammation as well. So I started having this when I was only 19 for the eyes. So I actually started with the eyes first rather than actually the back and also the ankle pain.
Wow.
So they're all linked. So now I'm being put on this biologic treatment. So I think it has been about 4 years now. So that is giving me a lot of relief and a lot of changes in my lifestyle. So I'm just trying to actually keep myself active and at the same time with the treatment. To actually.
I see. Mr. Yong, so you basically had this condition, AS, for 20 years, undiagnosed until you met Dato Gun, right?
Yeah, sort of. Because
Wow.
when I have this sort of pain, I will normally think that, okay, my grandpa, my uncles, aunties, they all have it, so it's normal, So until I can't really walk, then I have no choice but to seek medical attention.
Okay, wow. So it took 20 years to until it was the worst condition. Then you met Dato Gun. So,
Yeah.
what would you say are some of the biggest life impacts of this condition on you, and how did you cope with it?
You mean before the diagnosis or what?
In general, like throughout this 20 over years, what were the biggest like life impacts on on you based on AS, and how do you cope with it? So would you say, like,
Oh,
for example, not being able to perform your sports activities at its optimum, would that be one of the bigger life impacts?
yeah,
Like,
definitely. Yeah, definitely. But I have been having this sort of a mild to moderate kind of a pain, body pain, all this while. But I have been able to cope with it, and I've
I see.
actually been learning to see how to deal with it. By exercising, like what Dr. Khan has mentioned, the pain and also the body ache will actually goes away when you do more activities and so on. But it wasn't until 5 years ago that the situation was so bad that I can't even walk up and down of the stairs. So that was how bad it was. That was what prompted me to actually seek medical advice.
So you would say, in terms of your condition, the biggest life impact was actually 5 years ago, where you
Yeah,
actually finally seek medical attention.
yeah, correct.
Okay. Wow. All right. So it's very important. All of us are aware of the pains in our body, inflammation in our joints, what it is, and actually to seek medical attention based on Mr. Yong's story, actually. So thanks a lot for sharing, Mr. Yong. Now back to you, Dato. What are some of the coping techniques and support needed for patients who are diagnosed with ankylosing spondylitis?
You see, Macy, Mr. Yong's example is one of the classic example of many AS patients. As I say, undiagnosed walking out there, and they try to, you know, cope with the pain themselves.
Yeah.
And for those who do not have very good support and is not as strong as Mr. Yong, many of them were actually gone into depression, you know. They were so depressed that most of them may need to wake up middle of the night. They don't get a good sleep. They need to wake up middle of the night to ease the pain to walk around, and will actually lead to SMTs, you know, stop uh, not going to work and so on, and as a result may get fired, or the company is not being happy with them. So this is on the society, or to the patient as a whole. And many, of course, after a while, their spine become fused if they have this AS and not being diagnosed. They may have the complications as a result of the AS. The spine being fused, they may not able to turn their neck. You know, you can look at some AS patient. They walk like a robot because the spine it become one piece. You know, you can't bend. Some
Mm.
already fused in bend posture, so they walk like perpetually looking for money on the floor, you know, something like that, because they were looking like that and they unable to walk up. Some are actually that bad. And I have a patient, in fact, he worked as a cashier. So he's sitting at the cashier. And the posture, you can imagine, is so bad. It is hunched all the times. So at the later part of the AS, his chin was touching on his stomach. Can you imagine the posture where your chin can touch your stomach when you sit? So that bad. It bend in that, and we call that the classical question mark posture. And these patients, when you can imagine how they're going to lie down on beds at night, they will have a great difficulty. They may have breathing problems, and the spine is so stiff. If not careful, they have a fall, and they break easily. You know, they get osteoporosis, and so on. So this sort of impact happen in the patients. Overall, in Malaysia, most patients like Mr. Yung, when they have back pain, they say, it's just a simple back pain because when they go for activity, they feel better. At rest, they feel more pain. So they will keep on doing more and more activity and live with it until one day they cannot cope with it anymore. Only they come to seek treatment from the doctor. The other group of these patients, when I will want to introduce this term called spondyloarthropathy here. It's an umbrella of the disease where before patients have back pain, go to see doctor, and the doctor do an X-ray on the patient, and the X-ray is actually normal. Okay, the inflammation of the back can only pick up by doing MRI of the spine or over the sacroiliac joint. So if the patient do not have an MRI and just do a plain X-ray and the inexperienced GP think that is normal, so we'll just tell them, you're so young, you have nothing, it's just mechanical back pain. That's why the thing is missed. And if a patient have typical inflammatory back pain, like I said just now, together with X-ray, which is normal, and we call that non-radiographic SPA, spondyloarthropathy. So under this SPA, spondyloarthropathy, okay, they have two diseases inside. One is non-radiographic SPA, so before the X-ray changes. Okay, once there's X-ray changes, we call it AS. So AS is a little bit late, yes.
So, Dato, what would be the support available for patients with AS currently that you know? Like, for example, your pertubuhan or...
Yes, our pertubuhan, there's a Arthritis Foundation Malaysia, but more cater for people with peripheral arthritis. There is a AS support group,
Okay,
but I know it's not very active as far as I know, because AS happen in young people, people like Mr. Yong, it's just in the early 40, successful business. Every day is so busy earning money and so on. So they don't have much time for the illness, for the society. That's why the support group is not very strong, because when they get treated, they feel well, they just go back and more concentrate in their work, rather than join the AS support group to further increase public awareness. I do really hope the support group can become more active in the future.
I think there are some people from the support group here. So if you're listening, please seek Dato Dr. Gun's advice and keep it active and alive to help other patients. Now, Dato, in terms of the question for treatment, what are the treatment options available for AS? And generally, what's the long-term side effects for patients who do not seek treatment?
Okay, the treatment option, AS actually respond very well to a group of medicine called non-steroidal anti-inflammatory drugs. And basically, people say painkiller. Okay, but it's not Panadol, not Tramadol. This group of painkiller, like you take diclofenac, celecoxib, etoricoxib, this group of medicine. So usually patient will put on this group of medicine. We have a trial periods of about 3 months and to see how it respond. The other thing I forgot to mention is their blood. In patients with inflammatory back pain, when we examine their blood, the inflammatory marker in the blood usually will be increased. Namely, ESR, have you heard about that? And the C-reactive proteins. These are the two common inflammatory markers, it will be increased. So we will monitor patients with their symptoms and also these two inflammatory markers. And the other one is early morning stiffness and so on, and see how they are doing. So if they do not really respond well to this group of medicine called NSAIDs, the only effective treatment over now is biologic treatment, which is a new advancement of medicine over the last 15 years, biologic in AS, and actually has made so many people's life become so much better. So at the moment, they are approved 2 groups of biologics in Malaysia that we can use for AS. One is TNF alpha inhibitors, and the other group is interleukin 17, IL-17 inhibitors. So the doctors will tell you which is suitable for you. Have to assess you and see which one is good for you.
Okay. So what about the long-term side effects for those patients who don't seek treatment? What will happen to them?
I have mentioned just now,
Oh,
if they
yes,
don't seek
the
treatment,
question.
the spine will getting fused,
Yeah.
and
Okay.
and nobody aware of their posture. They get more stoop and more stoop. Actually, these people are really, really hunched and stoop. And if they have a fall, they can actually get fracture easily. They will have lung involvement because of the spine is fused. The lung expansion is actually very limited, and so on. And they are prone to certain diseases. So the quality of life is really bad.
Bad. So,
Yes.
okay, and now this is for the audience. If you have questions, put it in now because I have two last questions, one for Dato and one for Mr. Yong. So, Dato, my last question for you is, are there anything that patients need to be aware of while on AS treatment?
Okay, number one, I think we need to get to people who are out there. If you have inflammatory back pain, you can come forward for treatments. In fact, if you come to Pertubuhan Arthritis Negeri Sembilan website, the Facebook, you can have a direct link to all the rheumatologists, or you go to Arthritis Foundation Malaysia's. You can also email them and they can direct you to any doctors suitable in your locations. The Pertubuhan Arthritis Negeri Sembilan is in Negeri Sembilan. So we cater mainly for patients in Negeri Sembilan. But we know all the rheumatologists in Malaysia and we can direct you there. In fact, Maisie, last year, I have a public forums on inflammatory back pain. And a person, a sufferer, find himself exactly have this symptom like what we mentioned. He has inflammatory back pain and also arthritis. And through the Facebook website, he came and he found us. And now he's under our treatments. So people out there need to be aware that you have this condition rather than to endure with the pain and think that it's normal to have pain. It's normal, it's okay to have pain. It is not to find out why you have this pain, okay?
Okay, so also like the most important, so there's not much side effects if they're on treatment, right? No side effects.
The treatment is very safe.
Okay.
If there's any side effect, we will actually monitor. We will do some pre-tests before we start them if they are suitable to go on biologic treatment. And in fact, it's very safe. If they don't treat, they get a lot of long-term problems. Yes.
Right. So, Mr. Yong, thanks a lot, Dato, for answering all my questions. Now, I'm going to go to Mr. Yong for the last question. Mr. Yong, is there any word of advice that you'd like to share with others that are living with ankylosing spondylitis?
Well, the advice is to actually get treatment or medical advice as soon as possible. So do not drag your feet. So I think I have wasted many years. So I think all this could have been discovered a lot earlier. So seek early medical attention.
All right. Thanks a lot, Mr. Yong, for sharing your journey and also answering my questions. Now, I'm going to open today's session to the audience. So I see a lot of you are joining, staying tuned. Remember, share today's session as soon as possible so we can get the word out. So I think the first question is by Mr. Wong Ban Hin. Datuk, he asks, why is this age group, the younger age group, the most affected?
Yeah, this condition is that way, where inflammatory back pain usually somehow occur in people with younger age group. People with older age group get different form of disease. That's why many people think young people will not get any disease, which is not true. Okay.
Okay.
It's just that way. It attack people from teens to before 45.
Okay. So take note of this, everyone. So Mr. JC Lee asked, I think earlier you mentioned about an AS support group. He asked, where can he get access or reach out to this support group that you've mentioned?
I think they are not very active, but I will find out, JC. If you are a patient, you can come to our Facebook and leave a message. We will find out the link for you.
Okay. Or you can, Dato, you can pass it to me and I'll also post it on this comment section also.
Okay,
Now, the
sure.
next question is by Mr. Samuel Tan. He says he has chronic pain, but he doesn't know the cause. He can feel pain permeating through his limbs. So what should he do?
Okay, Mr. Lim, is it? So check your back pain,
Mr.
whether
Tan.
Mr. Tan. Okay, the
Yeah.
5 things that I mentioned just now is your onset of pain is before age 45. You already have the back pain for more than 3 months, and your back pain is insidious in onset. It's not a sudden got the pain, and your back pain worsen with rest, improve with activity, and you have night pain. And the night pain wake you up at night, and when you walk about, it relieves the pain. So if you have 4 out of 5, then you probably have inflammatory back pain, and best to come to see a correct doctor who treat this condition called rheumatologist.
Okay, hope that answered your question, Samuel. The next question is from Miss Irene Yap. She asked, she said this might not be connected to AS. So what about regular back pain and neck pain in seniors? What if the person has scoliosis? Can it further affect AS? And does massages help?
A scoliosis is another one condition by itself. Senior citizens with backache and neckache many times may due to degenerative spine problem, and we call that spondylosis. Or if senior people have new onset of a back pain, we are also very worried, So any back pain, we have to look at reflex of back pain. So whether the back pain may be associated with some malignancy where have a spread to the spine, or some refer pain to the back. So in such condition, you may have weight loss, you may have fever, and the pain, if the pain impinge on your nerve, spreading down to your heel, that also needs special attention. So you have to think of back pain associated with weight loss, with night sweat, with poor appetite. So those are the pain where you need to pay special attention.
Okay. And I think she asked, do massages help?
If it is a mechanical back pain, yes, a good massage, you feel a big release. Usually it's due to musculoskeletal, the muscle around the spine have some muscle strain, and that helps. But
Okay.
not inflammatory back pain.
All right. Okay, so not for inflammatory back pain. And Mr. Wong also had a follow-up question. Is there any way to prevent AS?
It is no way to prevent AS, because AS have some genetic link disease, a condition called HLA-B27, whether you have heard it before. So like Mr. Young, probably around the family, most people have the disease. So they are HLA-B27 associated AS. These are some genetic link where you can't prevent. At times, the onset of AS may be due to some triggering factors like infections, bacterial infections, viral infections. Somehow, something happened to you where it trigger off the immune systems, and that trigger off the AS. I have no study and no data to show how to prevent, but healthy lifestyle certainly help. If a person has AS, healthy lifestyle, smoking If you stop smoking, definitely help to reduce the symptoms of inflammatory back pain and so on. Prevent obesity. If a person is obese, your back also need to carry the whole back. When you're obese, with a big tummy in front, actually you cause even more back pain. And especially AS patient, when the thoracic spine is fused, the chest expansion is actually reduced. So this patient tends to have a big abdomen. Yeah, they become an abdominal breather rather than a proper breathing from the lung. So healthy lifestyle will actually help to cut down the symptoms of AS.
Okay. Thanks a lot, Dato. Madam Yo asks, is treatment and medication to be taken for life?
At the moment, once we start you on treatment, we will usually tell you it's taken for life. But throughout the treatments, we will assess you. At some point in time, there's condition called burnout AS. Means the AS no longer become active. So under such circumstances, we may stop you from treatment.
Okay, that's good to note. I think I'll take one last question from Lai Fong Lin. She says she has recently X-ray found a lumbar 5 spondylosis, disc degeneration to 2 mm. Doctor says nothing much to do except painkiller. Does she need further assessment such as an MRI test?
This one is typical of mechanical back pain, spondylolisthesis. You have to monitor your symptoms, whether there is any nerve root impingement or not. If it is not, again, healthy lifestyle, strengthening your back muscle, strengthening your abdominal muscle will actually help the back.
Okay, I hope that answered everyone's questions. Thank you so much, Dato, for answering everyone's questions. I think a lot of people are actually very informed now about AS through today's session. And also, I think a lot of people now are going to be more aware of inflammation in their joints and their back, I'm sure, their spine. I think for those of you who are watching, please share this out right now as soon as possible. Let's get the word out in conjunction with World AS Day 2021. Let people know that arthritis does not just affect senior citizens. It could also affect anyone from the ages of 15 to 45. Which is what AS, is for. So I believe that the next 2 weeks, there will be a break from Talking Live with Maisie. I will be coming back at the end of May. So please stay tuned for the next topic. And for those of you tuning in and asking questions, we hope we've answered all of your questions. So thank you so much for joining us, everyone. And more importantly, thank you so much, Dato Dr.Gun. You did a great job answering my questions, everyone's questions. And thank you so much, Mr. Yong, for sharing your journey. I wish you all the best with AS, and also that you get to manage it at like what you're doing now. Remember, everyone, stay healthy, lead a healthy lifestyle like Dato Dr.Gun mentioned, and stay safe. Thank you so much, everyone. Have a great Sunday ahead. Bye.
Thank you. Thank you very much.
Bye-bye.
Thank you. Thank you so much. Bye.
Thank you.